So now 83 students have come, eh?
Yes, so far 80 to 83, I think.
So I'm going to start my presentation, okay?
Yes.
So today I'm going to talk about ocular therapeutics, that is the drugs which act on eye, the important drugs which act on eye. So first of all, I'm going to present how these drugs, they act on pupil. You know, pupil is the central part of the eyeball, which is the gap in the iris. So in order to understand how eye drops affect on pupil, it is essential to know anatomy of the iris muscles. We all know there are two iris muscles. I'm sure you must know them. You know the names of the iris muscles. These are sphincter pupillae and the dilator pupillae. The sphincter pupillae, you know, is the muscle which is all around the iris at the central part close to the pupil. And the dilator pupillae muscle is on the peripheral part of the iris. And both these muscles are controlled by different nervous systems. A sphincter pupillae muscle is controlled by the parasympathetic nervous system, and the dilator pupillae muscle is controlled by the sympathetic nervous system. So these are the two different nervous systems which control the iris, and that's why pupil sometimes gets constricted, and at other times it gets dilated. So with this diagram, you can see the circular smooth muscles in the sphincter pupillae and the radial smooth muscles in the dilator pupillae muscles. And these muscles are responsible for the constriction or dilatation of pupil. Now, next slide. You can see when the circular muscles of the iris, they are contracted, they give rise to constricted pupil. And similarly, when the radial muscles of the iris, when they are contracted, they give rise to dilated pupil. So now you come to know that how the drugs cause constriction or dilatation of pupil by acting either on sphincter pupillae muscle or dilator pupillae muscle. Now we divide the drugs into four groups which act on pupil. So there are four groups of drugs which act on pupil. And these are the four groups. Parasympatholytic drugs, they are also known as anticholinergic drugs. Parasympathomimetic drugs, which are also known as cholinergic drugs. Sympathomimetic drugs, also called adrenergic drugs, and sympatholytic drugs, non-adrenergic drugs. So these are the four groups of drugs which act on pupil. Now take one by one. Parasympatholytic drugs. As the name suggests, these drugs block the parasympathetic nerves. These parasympathetic nerves, they constrict pupil due to liberation of acetylcholine at their nerve endings. So when the parasympathetic nerves, they are inhibited, pupil gets dilated. Dilatation of pupil means mydriasis, and at the same time, ciliary muscle gets paralyzed, which is called cycloplegia. So all the drugs which inhibit parasympathetic nerves, they dilate the pupil. That is, they are called mydriatic drugs. Now, these are some of the important drugs which belong to this category, that is parasympatholytic drugs. Most important one is atropine, The others are hometropine, tropicamide, cyclopentolate, and botulinum toxin. Now, among these drops, you must know few drops, first two drops, they are very important, atropine and hometropine, and you must also know their percentages. These all five drops, they are frequently used in ophthalmology. So just remember these important five drugs. There are numerous other drugs which act on pupil beside these five drugs, but just remember these five drugs with their percentages. Now, atropine drops, which are widely used in eye diseases, some of these conditions are uveitis. You know what is uveitis? It is the inflammation of the uveal tract. Second important condition in which atropine is used is called keratitis. That is inflammation of the different layers of the cornea. And the third important use of atropine drops is when you want to do refraction in children, then you put drops in the eye in order to dilate the pupil and to do cycloplegia. That is complete paralysis of ciliary muscle. So in these three conditions, you use atropine 1% drops. Besides atropine, we use botulinum toxin injection in paralytic squint and blepharospasm. Blepharospasm means spasm of the lid muscles. Now the second group of drugs called parasympathomimetic drugs. They are also called cholinergic drugs. Now these parasympathomimetic drugs, they stimulate the parasympathetic nerves. And when these nerves are stimulated, they liberate acetylcholine at the nerve endings. When acetylcholine is liberated, it causes constriction of pupil, that is meiosis. So parasympathomimetic drugs or cholinergic drugs, they all cause meiosis or constriction of pupil. Now, these are some of the drugs which belong to this category, parasympathomimetic drugs. They are classified into three groups. Directly acting cholinergic drugs, second, anticholinesterases, and the third, organophosphorous compounds. Now, directly acting cholinergic drugs, if you just look into this group, there are five important drugs among this category: acetylcholine, methacholine, carbachol, pilocarpine, and nicotine. These are directly acting cholinergic drugs or parasympathomimetic drugs. Second group of parasympathomimetic drugs called anticholinesterases. This group consists of these three drugs: neostigmine, physostigmine, and adrophonium. Physostigmine is also called acerine, and adrophonium is also called tensilon. Third category of parasympathomimetic drugs called organophosphorous compounds. And the best example of organophosphorus compounds is phospholine iodide, which is available in 0.03 to 0.25%. Now, look into some of the drugs where these drugs are used. Acetylcholine 1%, it's only available in injection form. It's not available in eye drops. Similarly, carbachol 0.01%, it is also available in injection form. And these are used during cataract surgery. Why? When you want to constrict the pupil after cataract surgery, then these injections are used. Pilocarpine drops, they are available in the form of eye drops, and the percentage varies from 1%, 2%, 4%. This pilocarpine drops, they are used in glaucoma, particularly angle closure glaucoma. You know, there are different types of glaucoma, mainly open angle glaucoma and closed angle or narrow angle glaucoma. So pilocarpine can be used in every type of glaucoma, but mainly in angle closure glaucoma. Now, among the anticholinesterases, these drugs, they inhibit the enzyme cholinesterase. I'm sure you must know what is the mode of action of cholinesterase enzyme. It is the enzyme which is responsible for the destruction of acetylcholine at the nerve endings. So when this enzyme is inhibited, acetylcholine is no more destroyed. It remains accumulated at the nerve endings and then it exerts its actions. So when acetylcholine exerts its action, you know, it causes constriction of pupil, that is meiosis. These are some of the important drugs which belong to this category, anticholinesterases. Neostigmine, this is used in myasthenia gravis. Isostigmine, 0.25% drops, used in open angle glaucoma. And adrophonium, it's available in injection. It's available in 10 milligram injection, and it is used in the diagnosis of myasthenia gravis. Now, the third category of parasympathomimetic drugs called organophosphorous compounds, and the important drug of this group is phospholene iodide, which is available in 0.03 to 0.25% drops. And this drug is used in open angle glaucoma and accommodative esotropia, which is a type of squint. Now, the third category of drugs acting on pupil. We have already completed parasympathomimetic and parasympatholytic drugs. That is, drugs acting on parasympathetic nervous system. Now, we are going to start drugs acting on the sympathetic nervous system. So, sympathomimetic drugs. They are also called adrenergic drugs. They as the name suggests, they stimulate sympathetic nerves. And when these nerves are stimulated, they liberate norepinephrine at their nerve endings. You know, in the previous slides of parasympathomimetic drugs, when those nerves were stimulated, they liberate acetylcholine. But when adrenergic drugs or the sympathetic, they liberate norepinephrine. This is the difference. So when norepinephrine is liberated, it causes dilatation of pupil, which is called mydriasis. So all sympathomimetic drugs, they cause mydriasis or dilated pupil. These are some good examples of sympathomimetic drugs. All these cause dilatation of pupil. Epinephrine, which is available in eye drops, percentage is 0.5 to 2%. Dipivefrin, 0.1%. Phenylephrine, 2.5 to 10% drops. Ephedrine, tyramine and hydroxytryptamine, and cocaine. These drops, they all affect on sympathetic nerves, leading to dilatation of pupil. Epinephrine drops, which are available in 0.5 to 2% drops, they are mainly used in open angle glaucoma, not in closed angle or narrow angle glaucoma. And you know a condition called Horner's syndrome. So in order to diagnose Horner's syndromes, this drug is used, which causes denervation, hypersensitivity in this condition, that is Horner's syndrome. But the drug epinephrine has some side effects. And the most important one is it causes cystoid macular edema, particularly in aphakic patients. You know, aphakic patients in which crystalline lens has been removed. There is no lens inside the eye after cataract surgery. And when you use epinephrine in those patients, they may cause cystoid macular edema. Epinephrine is also available in the form of drops, 0.1%, and also used in open angle glaucoma. And the third important drug which belongs to this group is phenylephrine, which is available in 2.5% drops and 10% drops. And this phenylephrine is used to either to dilate the pupil, that is mydriasis, or to prevent the formation of iris cysts in those patients who are using phospholine iodide. You know, the important side effect of phospholine iodide is to create iris cysts. And in order to prevent the formation of iris cysts, we use phenylephrine drops. Next, the fourth category of drugs which act on pupil, sympatholytic drugs. That is, these drugs, they inhibit sympathetic nerves. When these sympathetic nerves are inhibited, they block the release of norepinephrine at their nerve endings. And when the norepinephrine is blocked, pupil gets constricted, that is meiosis. So all sympatholytic drugs, they cause meiosis or constriction of pupil. These two drugs are the common examples of sympatholytic drugs. Number one is thymoxamine. It is specially used to reverse the mydriatic effect of phenylephrine. And gonethidine, 0.5% drops, used in open angle glaucoma, and it also used in TED. TED stands for thyroid eye disease. So in thyroid eye disease, this drug is used to decrease eyelid retraction. Now, these were the drugs which act on pupil. Now, next category is called antiviral drugs. Now, the antiviral drugs, they are mainly used in the treatment of herpes simplex type 1 keratitis. In ophthalmology or in eye diseases, antivirals mainly in the treatment of herpes simplex. There are various antiviral drugs, but just remember four important ones. And these are vidarabine, trifluorothymidine, acyclovir, and idoxuridine. These are the four drugs which have antiviral properties. Just remember, all these antiviral drugs, which are available either in the form of drops or ointment, they are effective against only DNA viruses. They have no effect against RNA. So vidarabine, it's only available in the form of ointment, 3% ointment, and it should be used 5 times daily for 2 to 3 weeks. Trifluorothymidine, only available in the form of drops, 0.1%, and these drops are used 8 to times daily for 2 weeks. Just remember, all these drugs are used in the treatment of herpes simplex type 1 keratitis. Third category is acyclovir 3% ointment. It is available in the form of ointment and used 5 times daily for 2 to 3 weeks. And the fourth one is idoxuridine, 0.1% drops. And these drops are used 8 to 10 times daily for 2 to 3 weeks. Now, next comes antifungal drugs. So we have completed drugs acting on pupil, antiviral drugs, and now antifungal drugs. Just remember, all antifungal drugs, they are fungistatic. They are not fungicidal. Fungistatic means they inhibit the growth of fungi. And fungicidal means the drugs which destroy fungi. So antifungal drugs are only fungistatic. This is commonly asked in your PCQ examination. These are some of the important drugs which belong to antifungal category. Amphotericin B. It is available in 0.1% solution. Nystatin, 1 lakh units per ml. Natamycin, 5% suspension. Ketoconazole, only available in the form of tablets, and the dose is 200 to 400 milligram daily. Fluconazole, in the form of eye drops, 1%. Miconazole, available in eye drops, 0.1%. So these are the 6 important antifungal drugs which are used in various fungal infections of the eye, particularly fungal keratitis. Next group comes corticosteroids. These are some of the important steroid drops which are used in different eye conditions. Dexamethasone drops, 0.1%. Betamethasone drops, 0.1%. Prednisolone drops, 1%. Fluoromethalone drops, 0.1%. You know, there are 20 or 30 other steroid drops. Just remember these 4 important drops and their percentages. Among these 4 drops, the most potent one is dexamethasone, and the least potent one is fluoromethalone. Now, all the steroid drops, they have certain complications. These complications can occur either in the eye, or they can also lead to systemic complications even with putting eye drops. Now, the ocular complications, just remember 3 important ocular complications of corticosteroids. Number 1, glaucoma. And this type of glaucoma is called secondary steroid-induced open-angle glaucoma. Secondary steroid-induced open-angle glaucoma. Second complication is cataract. And the cataract is called posterior subcapsular cataract. That is lens opacity is situated at the posterior subcapsular area. So glaucoma number 1, cataract 2, number 3 are corneal complications. And these corneal complications are due to reduced immunological protection of steroids. And these corneal complications are secondary bacterial infection or fungal infection or viral keratitis. And they are due to reduced immunological protection by the steroids. So these were the three important complications of steroids. Now, the systemic complications of steroid following short-term therapy. Short-term means less than 6 weeks. Dyspepsia, mental changes, and electrolyte imbalance. And the long-term therapy, when you use steroids for a long period of time, certain systemic complications can occur. And these are Cushinite state, which includes moon-like phase, obesity, hyperpigmentation, and hirsutism. Second important systemic complication is osteoporosis. Third is reactivation of certain infections like tuberculosis. And the fourth important complication is aggravation of pre-existing diabetes. So you have to be very careful to prescribe corticosteroids in patients with diabetes or tuberculosis. Next category of drugs which are used in eye are antibiotics. There are two types of antibiotics which are used in different eye conditions. And these are divided into two groups, bacteriostatic and bactericidal. Bacteriostatic means these drugs suppress the growth of microorganisms. And bactericidal means the drugs which destroy the growth of microorganisms. Now, next is concentrated antibiotic drops. It's also called fortified antibiotic eye drops. Now, how these drops are prepared, that is fortified eye drops. They are prepared by mixing an injection preparation with artificial tear drops. Like you take a vial of gentamicin or tobramycin or cephalosporin and mix with artificial tear drops to get concentrated drops of antibiotic. Fortified eye drops, they are used in severe corneal abscess, endophthalmitis, and panophthalmitis. These are the three important eye diseases in which you use fortified antibiotic eye drops. Normal antibiotic eye drops, they are totally useless in these severe conditions. So you have to increase concentration of antibiotics by at least 5 times. Now take one by one, just see this example, tobramycin. Normally, tobramycin drops are available in 0.3%. But when you make it fortified drops, it becomes 1.5%. So 5 times increased in potency. And these drops, when you see these severe conditions, then use these drops. Now next comes the drugs, systemic drugs, which have ocular side effects. These drugs are given for some other conditions, but they have effects on eye. The best example is chloroquine. You know, chloroquine is widely used in the treatment of malaria, and it is also used in systemic lupus erythematosus and rheumatoid arthritis. In these last two conditions, chloroquine is used for a longer period of time. So when chloroquine is used for a prolonged period of time, it has certain side effects on the eye. And these side effects are of three types. One is called keratopathy, that is pigmentation of the cornea. Myopathy means weakness of eye muscles, and retinopathy means affection in the retina, which is called bull's eye maculopathy. So chloroquine, whenever chloroquine is prescribed in any type of these patients, you must examine eye for any of these side effects. Next drug is ethambutol. Ethambutol is widely used in the treatment of tuberculosis, and it is also used for more than 6 months. So when this drug is prescribed in TB patients, you must examine the eye to look for any side effects. And the most important ocular side effect of ethambutol is optic neuropathy. And this optic neuropathy is not very common. It only occurs in 2% of patients receiving ethambutol. So whenever you see the changes in the optic nerve in a patient receiving ethambutol, you must ask the physician to stop the drug, because once the drug is stopped, then the side effects get reversed. This is a plus point of this drug. Third is digitalis. It is used in many cardiac patients. So when digitalis is prescribed for a prolonged period of time, it can lead to certain eye problems. Number one, xanthopsia. In xanthopsia, patient will complain that the objects appear like they are covered with frost or they have pale yellow cover. So xanthopsia is a symptom which a patient can tell you who is using digitalis for a prolonged period of time. Oral contraceptives, they also give rise to certain serious side effects like occlusive vascular disease. Occlusive vascular disease means either retinal vein occlusion or arterial occlusions, papilledema, which is the edema of the optic nerve head, optic neuropathy, and retinal hemorrhages. These complications can occur in a patient receiving oral contraceptives at frequent intervals. Fifth is hypervitaminosis A. That is a person who has taken vitamin A for a prolonged period of time. It is like jaundice-like appearance, raised intracranial pressure, and papilledema. And sixth one is alcohol intoxication. This can give rise to nystagmus, esophoria, diplopia, and toxic optic neuropathy. These four important side effects are related to excessive intake of alcohol. Now this finishes this presentation.